Good morning. Thank you so much for joining us. My name is DJ Hampton. I'm the President and CEO of Trident United Way, and we are being joined by United Ways across the state of South Carolina, as well as the Carolinas Credit Union Foundation, to launch the ALICE report. A few housekeeping items as we begin. Please place your questions into the chat and include your email address. While we will endeavor to name as many questions as we can and give you the answers to those, we may not be able to answer all the questions, and having your email address will allow a staff person to follow up with you afterwards. And now let's talk about ALICE. ALICE is an acronym. It stands for Asset Limited, Income Constrained, Employed. And this is the story of hardworking families who make above the federal poverty line, but not enough to afford all of life's basic necessities. We all know ALICE. Heck, many of us have been ALICE at some point in our lives. ALICE families work multiple jobs, often living paycheck to paycheck with very little savings to fall back upon. And sadly, as we know, cost of living has been going up. As costs of living have gone up faster than wages, the population of ALICE across the state of South Carolina and across the country has been growing. We're working hard to raise awareness of these ALICE families and to tell their story. We believe every ALICE family deserves the opportunity to thrive. ALICE is a partnership between United Ways across the state of South Carolina. And I'm going to ask each of them to introduce themselves so that you can know who we're working with.
Hi, I'm Ellen Luton, President of the United Way of Aiken County.
United Way of Anderson County.
Black River United Way.
United Way of Florence County.
United Way of Horry County.
United Way of the Lakelands.
United Way of Lancaster County.
United Way of the Lowcountry.
The United Way of Oconee County.
United Way of the Piedmont.
United Way of Sumter, Clarendon, and Lee counties.
United Way of Pickens County.
United Way of Greenville County.
United Way of York County, South Carolina.
We are United Way.
Thank you all. And now I'd like to introduce Dr. Courtney Howard. Courtney is the Chief Diversity Officer and VP for Diversity, Equity, and Inclusion at the College of Charleston. We're also blessed that she's our current Community Impact Chair at Trident United Way. Through her work at both organizations, Courtney has seen firsthand the obstacles that the hardworking ALICE families are experiencing every day. Courtney?
Well, good morning. Thank you, DJ. I appreciate that introduction. Somebody recently said we are all one crisis away from financial devastation. The question then becomes, how big does that crisis need to be? Now, for some of us, it would take an unimaginable crisis or a set of unfortunate circumstances to bring us to our knees because we have assets we can more easily access. Things like a savings account or access to non-predatory credit to help with the expense of that crisis, or paid time off from work to buy us time to deal with the situation, or even a stable safety net of support. People like our family and friends who themselves can afford to pull away from their own lives to help us deal with our situation. But for others of us who are more like Alice, that crisis need not be more than a car that won't start, or a lingering health issue that needs attention now, or an unexpected or higher than normal bill, or really any other issue that interrupts our lives beyond what we can handle. Many of us and our neighbors can relate to Alice. We work hard, sometimes multiple jobs, serving our community as teachers, as child care workers, classroom assistants, health aides, cashiers, security guards, grocery store workers, office clerks, even the restaurant server. All kinds of jobs and roles that each of us depends on every single day. But as hard as we work, sometimes it's still not enough to get by. And why is that? Because the amount of money it takes to live here far exceeds the amount of money we make. Now, I'm not even talking about living a life of luxury. I'm referring to basic household expenses, survival. Alice is struggling to survive. Alice's income is high enough to not qualify for many programs that serve people living in poverty, but Alice is still struggling to survive. At Trident United Way, we provide free tax filing assistance to help Alice and others access tax credits and refunds that they're eligible for. This is huge. This is a very important resource. We also have resource connection centers that do just that. They connect Alice and others to the resources and programs that help with basic needs, help to deal with a crisis, help individuals move towards self-sufficiency. Trident United Way also offers Berkeley Food Share that brings fresh fruits and vegetables into homes at an affordable cost. This helps with financial health as well as physical health. So Alice is an important part of our population and part of us. We all know Alice, we may even be Alice. And the resources at Trident United Way and other United Ways across our state really help support Alice. So let's unite to raise awareness of the struggles that Alice faces and the solutions we can all deploy in our communities. Thank you.
Thank you, Courtney. Bringing a report like the Alice Framework to life is truly a community effort. And we would like to take this time now to thank our sponsors at the Carolinas Credit Union Foundation for their partnership in making it happen. And I'm also honored to introduce you to Lauren Whaley. For over 30 years, the Carolinas Credit Union Foundation has worked across both states in disaster relief, empowering communities, and making sure that everyone has an opportunity to thrive. And with that, I'd like to invite Lauren to join us for a few words. Lauren?
Well, thank you, DJ, for the introduction. Again, I'm Lauren Whaley, president of the Carolinas Credit Union Foundation, and we serve as a partner in philanthropy for credit unions across North and South Carolina, ensuring that they are empowered and inspired to meet the needs of our communities across our two states. We are extremely excited to be a partner with the release of the Alice report in South Carolina, because the Alice data gives all of us an understanding about everyday people who are working hard and struggling to manage their finances. And this is valuable to us as we work with our credit union partners to identify the best ways to allocate our resources. So since the data is for each county, it gives local credit unions invaluable information on how to develop, deliver, and target products and services to meet the needs of members and the communities credit unions are serving. So thank you, DJ. We look forward to this partnership.
Thank you, Lauren, and thank you for the support of the Carolinas Credit Union Foundation. Now, we are delighted to have Dr. Stephanie Hoops joining us from United Ways of Northern New Jersey. Dr. Hoops is the National Director for United for Alice and will be sharing background information on the Alice Project and the methodology that comes behind the report. Following Dr. Hoops will be Katie Reams, our statewide director for United for Alice. Katie will be diving into some of the report findings and sharing key statistics that matter here in South Carolina. Dr. Hoops?
Hello, I'm Stephanie Hoops, the National Director of United for Alice. We're a national research organization that developed the Alice measures about a decade ago. I hope by now you've heard the acronym ALICE. It stands for Asset Limited, Income Constrained, Employed. So we all know Alice, maybe not by name, at least yet, but these are folks who earn above the federal poverty level, but below what we call the household survival budget. And we all know Alice in our communities, essential workers, folks that got us through the pandemic. Many of us have family members who are Alice, and many of us have been Alice ourselves. Alice is a critical part of our communities. So why did we develop these Alice measures? Well, as you probably know, the federal poverty level is woefully short in estimating what it costs to live and work in our modern economy. And it doesn't take into account variation in the cost of living. So our measures, and the key measure is the household survival budget, measures that bare minimum of housing, childcare, food, transportation, healthcare, a smartphone plan, and Alice pays taxes. And then we look at household income and see how many folks are earning above or below that survival budget. So for example, in South Carolina, 15% of households are below the federal poverty level. Another 29% are ALICE. So together, instead of financial hardship being 15% as measured by the federal poverty level, we see poverty plus ALICE totaling 44% of households in South Carolina. So what goes into developing these measures and updating that data? Well, we work with a fantastic but small research team at United for ALICE. And then we really like to partner. We partner with United Ways across the country. And as part of our process, we have external research advisory committee members, folks who are experts in different areas of the survival budget as well as the economy. And so that expertise helps us update our data, ensure that we're doing best practices, and making sure that the data fits with the local context of where our report is going. And so we have about 250, 300 research advisory committee members working with us across the country. The methodology is rigorous, it's been tested, and perhaps most importantly, it's completely nonpartisan, unbiased. We need everyone in our communities to understand financial hardship before we can begin to build solutions. So it's important that that data is not controversial. It's just the facts. So in addition to this strong methodology and that history, South Carolina will be our 29th state that we do a deep dive. And as such, there are fantastic partners across the country where you can learn from. So I invite you to visit our website, unitedforalice.org, dig into the data, but also see what kind of actions are being taken across the country. There's a ALICE in Action page that you can dig into, as well as lots of tools and resources that can help you in your work. So we look forward together to helping ALICE in South Carolina.
Good morning, everyone, and thank you so much for joining us at the ALICE launch for the state of South Carolina. We are so grateful that you could be here with us today as we start the South Carolina ALICE project. And thank you to Dr. Hoops and the United for ALICE team for their wonderful work on our report. Our next steps with this work will be to walk through what the ALICE report looks like for our state and what it can mean for our communities and how we can work to support our ALICE households. So, next slide. Who is ALICE? What does that look like? ALICE, as we've talked a little bit about so far, is asset limited, income constrained, employed. And those are the individuals that are working, often more than one job, but at least one job. But because of their assets and what they're making, they just aren't making enough to make ends meet and to meet their basic needs in the household. And it's a new way of defining and understanding the struggles of households that earn above the poverty level but not afford enough to afford the basic needs. And so it's really important that we start to think about how do we have the conversation about an often invisible group in our community, an often overlooked group in our community, but a group that still needs support and still needs resources. And so we want to use data to make data-driven decisions, to work to support and find solutions to support those households and those individuals. Next slide. So in South Carolina, there are approximately 2 million households. You'll notice we always talk about households when it comes to ALICE. And that's because a household can be one person, but a household can be lots of things. A household can be 5 roommates. A household can be 2 married people with 2 or 3 children. And a household could be a single parent with 3 kids. And so we know that that variability of the composition of household matters. And so when we talk about those things, we talk about households. So in the state of South Carolina, there are 2 million households. Of those 2 million households, 878,000 of those households fall below the ALICE threshold. And what that means is they are simply not making enough to meet basic needs, and they often cannot make ends meet from month to month. That includes individuals that fall in the ALICE category and those that fall below the federal poverty level. That is 43% of households in the state of South Carolina, which to us and us working here at United Way is a staggeringly high number. And we find that we need to expand our conversation. We need to expand our work, and we want to expand that to include all of our partnerships, those in business and governments, with our local nonprofits, and with our academic partners to continue to support those families. So as we mentioned, here you'll notice on this next slide, with the federal poverty level, we kind of toss that word around a lot, but what does that mean? What is the federal poverty level, and how is that lined out? So you'll notice here, this is the federal poverty level. This is how it's lined out. It is lined out by household size. You'll see it's determined by 1, 2, 3, 4, and that is just simply the number of people in a household. There is no other variability in that. Doesn't matter where you live in the 48 states, or the composition of that household. Is it seniors? Is it children? That doesn't matter at all. It doesn't matter if you live in St. Stephen's or San Diego or Austin, Texas. None of that matters. It just matters sheerly the number of people in the household. And then you'll notice that annual household income is determined by that household size. And so what we recognize is that just is not enough information to determine how sustainable a household is, how much income they would need to make ends meet. And yet we base most of our eligibility and intake on those things. Our eligibility for things like SNAP and TANF, and for a lot of our nonprofits and assistance things are based on the federal poverty level. And so what we want to do with this work is expand that conversation and encourage variability in that. And so what we know based on the ALICE Household Survival Budget, as you can see on this next slide, is that ALICE Household Survival Budget does just that. It creates variability. It shows that you have to consider categories like housing, childcare, food, transportation, healthcare, technology, because all of those things matter to even just meet the basic needs of a household. And so we break that down. Then you'll also see that breakdown for whether that person is an adult or a senior, or whether there are children in that household and the ages of those children, recognizing that the ages matter, especially when in regards to food and child care, that those costs can change dramatically as the ages of the individuals in the household change. And so we find that can be really important to have that variability. And as you can see here, on average, in a household for 2 adults with 1 infant and 1 preschooler, the total annual amount needed would have been $58,000 in 2021. And so that's a huge number in South Carolina. And then what we also know in South Carolina is that number can change depending on where you live. And so on this next slide, you'll notice that we have that ability to do that with this ALICE report. We have the ability to change that within the counties. And so we have a wonderful website on unitedforalice.org that is specific to South Carolina, where you can access all of this information for the counties. You can drill down to the county reports and look at what the ALICE households look like in each of the county, their demographics, their breakdown in age, in race, and gender. You can also look at legislative districts, labor force. You can look at the different household composition and the budgets for each of those households. So we really encourage you to connect with that website. You can download the entire statewide report because it's important to know what this variability looks like, to know what your specific community is facing, so that we can know the right questions to ask and that we can work together to find those solutions for those households. Because we can tell based on this specific map that what's happening maybe in Berkeley County is not the same thing that's happening in Marion County, is not the same thing in Orangeburg, and is not the same thing in Oconee. And so it's important for us to recognize those differences so that we can answer those issues appropriately. And then as we move towards the end of the report, you'll find that there's a lot of information on the labor force because, as we know, with the E in ALICE, those individuals are employed. And so what does that mean to be employed in South Carolina? What does that look like? And based on this slide, as you can see, only 21%, which is a statistic that I certainly was shocked by, only 21% of employed individuals in the state of South Carolina are employed full-time and salaried. And so what we know about typically with full-time employed salaried employees is that they are typically the employees that are able to have flexibility. They typically have benefits like health insurance and PTO and the ability to have things like short-term or long-term disability insurance. And they can leave work to go to doctor's appointments and still get paid, or pick up their kids, or whatever that may look like. And a lot of other positions, when they're hourly, they simply don't get paid when they're not there, or they don't have PTO or sick leave, or they just don't have health insurance opportunities, or certainly retirement options. And so what we recognize is that's only a fifth of the state's working population has that full-time salary. And so how do we have those conversations moving forward? What are other opportunities, even beyond wages, that employers can offer to support the ALICE households? And how can we as a community work together to find long-term solutions for our working population? And then at the end here, you can see the most common occupations to also be ALICE. And so some of these, I think you won't be incredibly surprised to see. I think it is not surprising to maybe see cashiers on this list. We typically think of that when we think of maybe, when we think of hourly employees that maybe aren't making enough, or wait staff. But what we, I think, often don't think of in some of these categories that are very surprising are teachers, registered nurses, supervisors of those retail workers. And so what we recognize is not only do we want to support those occupations that we aren't surprised by, right? So we want to support those cashiers, and we want to support those food and beverage workers, but we also need to make sure we're shining a light, and those other spaces are not invisible, that we recognize and understand that there are a lot of categories that are surprising to us that are ALICE. And you'll note that a lot of wages have gone up in the last several years, but unfortunately they haven't gone up at the rate of inflation, and they just simply haven't caught up with the cost of living. And so what we know is that overwhelmingly intervention is needed across the board. We recognize that we need businesses, governments, nonprofits, educational institutions to hopefully use this ALICE research to educate our community about the need, to track financial need over time, to frame appropriate questions, and to generate solutions to talk about and work through the problems that we're facing. It can't be something that we as United Way fix alone. Even all of us across the state, it can't be something that the government system fixes alone or the nonprofits fix alone. It has to be something that we work together to achieve, and we're excited for that work. We want to do that. Because what we do know is that there are great, wonderful benefits to sufficient income in households. Some of those benefits are things like improved physical and mental health, increase in labor force participation across the board, increased graduation rates, lower healthcare costs also across the board, and then asset building and the ability to withstand emergencies within those individual households. And so what we recognize is that if we have sufficient income in those households and we work to support those households and find great solutions for them, that overall we all do better. And so we are working together across the state with our United Ways and all of our partners to come up with those solutions and use this report to create some of those great solutions. And so if you're interested in that work and partnering with us, there's lots of ways to do that. You can reach out to us directly. We will put that information in the chat box with how to do that. And you can email me, or you can fill out our information page where you put in your information and where you're located, and we will put you in touch with the right United Way to do that work. We will put you in touch with them so that you can figure out, where is your role? Does that mean you engage locally with your nonprofits, your municipalities, your United Way, you volunteer, you donate? Because we want you to be part of the solution. We want to engage with this work. And if you're already a nonprofit engaged in this work, how do we help you in that? How do we help you build your capacity, change your eligibility, use this report to write grants? And so we are open to any and all creative ways to have solutions, and we appreciate your time today and you joining us. Thank you.
Thank you, Dr. Hoops and Katie, for sharing information on the ALICE framework here in South Carolina. We are honored to be the 29th state to leverage this framework. The ALICE report shines a light on many pieces of information that is frustrating and also challenging to those of us who care about other families. However, it's also a chance for us to celebrate incredible work that is going to provide opportunities to every ALICE family in the state. As you can see on your screen, there are many programs already established by United Way of South Carolina currently providing assistance to the ALICE population. For instance, the free tax filing assistance from United Way of Pickens County helps those who fall below the ALICE threshold file taxes for free. And the United Way of York County Child Care Assistance Program, providing York Technical College students who fall within the ALICE income category financial subsidies for their needed child care. It is now my pleasure to introduce you to Tori Brain from Trident United Way's Dorchester Resource Connection Centers. The Resource Connection Centers are hubs bringing needed services to families to help them thrive and achieve economic stability. This is but one example of many across the state of South Carolina. Tori will now share a few stories and anecdotes from the Barriers to Employment Fund. Tori?
Thank you, DJ, and thank you everyone for being here. I am excited to tell you a little bit more about our Barriers to Employment program. We do have this fund to assist people in either gaining or sustaining employment. We can help with initial expenses like a bus pass to get to and from work, a week's worth of scrubs for somebody who just started in the medical field, or even steel-toe boots. We can also assist with unexpected expenses that come up with a person who already has employment, such as new tires for their car, when they need that to get to and from work. However, they don't have the savings to be able to get them themselves. I do want to tell you two quick stories about people who I have helped in the past with this fund. The first one is about a gentleman who had been recently released from incarceration. He had used his time wisely and he had gotten his welding license. He actually had a job waiting for him when he got out. However, he had to acquire all of his gear himself. With the fund, we were able to make all of his purchases, and he was able to start work the following week. We bought gloves, protective clothing, we got his welding mask, all of that. I was able to follow up with this gentleman about 6 months later, and he had retained his employment and also gotten an apartment himself. He was well on his way to financial stability. The next client was actually something we see quite often with our Alice families. It was a working mother who was able to work part-time with the help of her friends and family with childcare. However, she was looking for more stable and consistent childcare in order to get more hours. We were able to help her with 2 weeks of childcare for her to get her first big paycheck and then be able to sustain the childcare on her own. She was able to work to full-time with that more consistent professional childcare. She actually sent me a picture on her first day with her and her child dropping them off at childcare, and she was so excited. They both looked over the moon. I'm so excited to use this fund every time I get an opportunity to use it. It's definitely one of the best parts of my job, and it definitely helps our Alice community.
Thank you, Tori, for sharing these experiences from the center. As you heard, having access to daycare or the proper equipment can make the difference between employment or not working. And at this point, you might be saying, so what? How can I help? Where can I offer my support? Well, here's a few ways you can help. Engage with the South Carolina report and website. In other words, read the report. Share this information with your staff, boards, community, local leaders, and volunteers. If you're an employer, look at your benefit package and see how you can change the trajectory for Alice families. You can join us in advocating. Learn about what's occurring in the community. Volunteer to get involved. Last, call 211 or connect with your local United Way to get involved with their current programs, volunteer opportunities, donor opportunities, and local next steps. On behalf of us all, thank you so much for joining us today. And now we'd like to open it up for questions. A reminder, please put your questions in the chat and include your email address, so if we're not able to address all the questions, we can follow up with you afterwards.
Well, thank you. Here on our panel today to answer your questions, Katie Reens and I are joined by Dr. Ashley England. You might have heard some of her comments there in the chat. She is the Director of Research and Strategic Analysis with United for Alice, and we're just excited and very glad that you're here with us today. And now we'd like to open it up for some questions. You've had a number of questions that have come into the Q&A, and we'd like to get through as many of those as we can. And just a reminder, if we can't get through all the questions, please include your email address and we will follow up with you afterwards. And so the first question, and I'll ask you, Dr. Ashley, to answer this one. Can you tell us a little more about the methodology and why the 2021 data points are being used now that we're in 2023?
Yeah, sure. So one of our main data sources is the American Community Survey from the U.S. Census Bureau, and that's where we get all of our income estimates and our population breakdowns by location. And so we really rely on that data to then take the survival budget for that year and compare it to what households are making so that we can make those estimates around the percent that are Alice in each community. And that data is on a 2-year lag. So we don't have the next data coming out will be for 2022, and that should be hopefully coming out in December. We're going to be moving to hopefully annual updates of Alice data as we have that come available, but there's always that 2-year lag. And so it's really important to point out that 2021 was a really unique year when there was a lot of pandemic support available to folks that wasn't available before and is no longer available. And so the end of the report, you'll notice, talks a lot about the warning signs on the horizon and some of the things we're seeing around the conditions actually probably getting worse as, you know, no longer having pandemic impact payments and the tax credits around the child tax credit and the child independent care tax credits have gone back down to pre-pandemic levels. So definitely something we're keeping an eye on, but yeah, there's always a little bit of lag in that time point, but still really important why we're looking at it over time to see those trends and where things are going.
Thank you, Ashley. This question is for Katie. Katie, how can we get involved with our local United Ways to lift up Alice?
That's a great question, DJ. So there's a couple of different ways that you can do that. We have 14 participating local United Ways across the state, which we're incredibly excited about. I'm sure you've seen them chatting in the chat box. There will be a survey that we send with the follow-up information following this webinar. And in that survey, at the very end, will be a place for you to put your name and your county and your email to get connected with your local United Way. And we would love to plug you in with them. They're incredibly passionate about this ALICE work and how they're serving their community. And there's loads of ways to plug in, whether it's volunteering, whether it's engaging in their work with their committees and their boards, whether that's in a donor capacity, or whether that's just being an advocate with this information and educating the community using this report in your own space. That's whether you're in education, in a business, working with a nonprofit. It's really important that we do that moving forward. So please do fill out that survey so that we can get you connected with the right local United Way.
Thank you, Katie. Another question that popped up: how does South Carolina's ALICE threshold population compare to other states? And what have other states done to successfully support the ALICE population that could be applied here in South Carolina? And Ashley, would you mind answering this one?
Yeah, sure. So we have a page, our national overview page on our website, where you can actually look at that ranking. And at the end of the report, there's also the state ranking. Generally, the percentages of people below the ALICE threshold are higher in the South compared to other regions. And in terms of the ranking, I'm just sorting it right now live. Give me a second. So it looks like, yeah, South Carolina is number 33 with the highest percent of below the ALICE threshold. And that ranges from 32% in Alaska to 52% in Mississippi and 51% in Louisiana. So we do see those higher rates tend to be in the South. And to learn more about what others are doing across the network, we have our what we call our ALICE in Action database that we've been collecting some of those actions that partners are taking using the data across different areas. I'm going to put that in a link to that in the chat, but you can look there and sort by topic, subtopic, population, and it's a great way to get some inspiration about what to do to make a difference. Because we all need to be working together on this. So yeah, I really appreciate that question of we know the data, now what's next? That's probably our favorite question.
Thank you, Ashley. Henry Gustafson had asked a question about how can this information be leveraged to partner with state agencies? Think of those like DO and other groups. Katie, would you mind kind of giving some thoughts on that?
Yeah, that's a great question, and we love that question. Good news is we're already working with some of those state partners, and a great example is Dr. Brian Grady, who works with DO, was on our Research Advisory Council and helped us with the formulation and review of this report. So we're already in partnership with them. But certainly our hope moving forward is a couple of pieces. Is one, to educate the departments on where we are, the reality of our community need, and what the need and accurate portrayal of that is. But then also, what are next steps? How do we support these communities? What are needed? What is a good realistic standard of eligibility for programs? If the federal poverty guideline is inadequate, what would a more accurate portrayal look like? How do we advocate for that and look at that from a legislative perspective? And so we are going to continue to directly engage with those elected officials and those government departments so that we can move this work forward to best support our community.
Thank you, Katie. We had another question come in from anonymous attendee, and sorry about the non-identification there, but there's a question around what goes into the unemployed/other category that was shown. They indicated in their comment that 22% seems really high. And again, not all of us understand the data and how things actually work. So Ashley, would you mind answering that question?
Yeah, sure. And I was just looking at that labor force again, because actually unemployment rate is generally pretty low, because what the unemployment rate includes is just people who were actively looking for work at that time. So not working, but looking for work. If you're no longer looking for work, which might be because of childcare reasons, not being able to find a job and giving up after a while, or moving, or having other dependents or senior care, like there's a lot of reasons people aren't working. But when you stop looking for jobs, you move from that unemployed category to out of the labor force. And I think that's that bigger chunk that you're talking about. That was, 21%. So 18% out of the labor force due to retirement, and then another 21% not in the labor force for other reasons. And so that's the working population, everybody over 16 and over. So some of those folks are students. Some of those folks are, like I said, caregivers, not looking for work. So there's a lot of reasons why people are out of the labor force, but it is a big chunk of the population. And in a lot of places, we're seeing that growing over time. But it can kind of conceal that there's a lot of people that like aren't unemployed. You think they might be unemployed, but they're actually out of the labor force, according to the Bureau of Labor Statistics.
Thank you, Ashley. I've had a few direct messages that have gone along the lines of something like, I'm highly motivated, I want to help. How do I get to that legislative tool that was referenced earlier? Katie, would you mind walking us through how to get to that?
Yeah, that's great. So not only do we have this fantastic report, which we're incredibly excited about, we also have a wonderful website tool. And so if you go to unitedforalice.org, you can go directly to the Research Center and partner states and hit South Carolina. And South Carolina has its entire own page where you can download and interact with all of this information. And on that South Carolina page, there are links specifically for legislative tools and legislative districts. And if you click on that page, you can interact with your different state and federal representatives and senators. And it enables you to see what those districts look like, what the ALICE population and poverty levels look like in those districts, and some breakdowns for demographics as well.
Thank you, Katie. And sadly, that's all the time we have for today. And we will follow up with any remaining questions by email. If you had a comment that was anonymous and would like additional information or other thoughts come up, please don't hesitate to reach out to Katie Reams directly and ask her for that. We'll make sure her contact info there is in the chat. And I also want to say thanks to Katie and Ashley for sharing their responses to those important questions. And to all of you, I just want to say thank you for your engagement and dialogue today around this important topic. Gaining a better understanding of what ALICE's families experience is of vital importance to the future of South Carolina. We hope you leave this session with valuable data that will inspire action and to focus on your communities and the state of our families across this state. And we look forward to partnering and helping you turn ALICE data into actions so that we can affect your community. And thank you for attending today. Have a great rest of your day.